Thank you for your interest in our paper published in Rural and Remote Health. My name is John van Bockxmeer and I'm a rural generalist here in Port Hedland. The audit of sepsis in Hedland project was approved by the WA Country Health Service and Aboriginal Health Council Ethics Review Boards. The authors were motivated to complete this retrospective cohort analysis after observing higher than expected rates of sepsis in the Pilbara region of Western Australia. Our project explores the demographic factors, disease specifics and outcomes of patients with clinician-diagnosed sepsis presenting to the Hedland Health Campus over a 6-year period. We found there is a high sepsis burden in patients presenting to our remote ED. Our small, early data study suggests that within our patient cohort, the Aboriginal sub-cohort presented with worse clinical sepsis scores than non-Aboriginal patients and are regarded as sepsis positive by our standardised clinical management pathways. This group is also more likely to present by ambulance, require skin and soft tissue source control, have higher QSOFA and SIRS clinical scoring criteria, higher lactate values and increased critical care requirements, but similar mortality rates. Some possible contributing barriers to hospital presentation include multi-generational trauma, institutionalised racism and reduced trust in healthcare services. Due to the wide range of potential sources of sepsis, a whole-of-health approach addressing the social determinants of health may help reduce the elevated burden of communicable disease in remote populations. We make commentary and suggestions on how we can work harder to close the sepsis gap and invite you to read our paper to find out more. Further study is needed to assess the health systems factors responsible for our results in order to build trust and access to culturally safe healthcare for all Australians.